Thank you. Before I say anything, I wanted Senator Dismang and Representative Murdoch to be up here because I think they represent the bipartisan nature of how you go solve problems, and that's what Jonathan was just referencing a minute ago. Representative Murdoch's been in the middle of this forever, I guess, and has helped guide through it, and Senator Dismang and some of his colleagues have expressed and asked a lot of questions that's caused the debate to even move in a different direction. But I think the important thing here is that, as has been mentioned, you got to have 75 votes for something like this. Under our Constitution, this appropriation requires 75 votes. That doesn't happen with a legislature that is roughly divided on a partisan basis. So if Republicans and Democrats don't work together, if Republicans and Democrats don't find common ground, if Democrats and Republicans don't listen to each other, it's fruitless. It's not going to happen. And so Jonathan mentioned we don't need to get like Washington, and we dang sure don't need to get like Washington. They've got to be able to work together. They've got to be able to listen to each other. They can disagree, but they've got to do it agreeably, and they've got to figure out a way to work it together. And I wanted both of them up here so you could see them. Thanks, guys. I'm not going to reiterate everything that's been said about extending health care coverage. You already know that. I'm not going to talk about the fact that this could actually help businesses, because a lot of the part of the federal health care reform that a lot of businesses don't like can be advantageously affected and some of their responsibility removed by the passage of this. I'm not going to talk about the fact that this is going to save a lot of hospitals, because whether we pass this or not, hospitals are paying for it, because they've already received, and what's already passed in Washington that we don't have an option on is that Medicare cuts to hospitals are helping to pay for Medicaid expansion. So that's going to happen. So we're paying for it whether we take it or not. Here's what I want to concentrate on. This is the point I want to make. All those other things are actually true. And I support everything that Dr. Fincher said and that Ray and everybody else has said. They have told you exactly the way it is. And we could stand out here for lots of hours and talk about all the nuances. But I want to say one final point on it. We're going to pay for it. I don't want to leave our people out. I don't want to pay for Michigan and California and New York and North Carolina and everybody else and leave Arkansas out. Here's what I want you to do. I want you to be very respectful, and I know you will be. I know our auxiliary folks, because Ginger's been a member of that auxiliary for a long, long time, and I know they can get after you if you're not careful. But I want you to be careful. And I want our AARP folks, I want our physicians and our healthcare folks, I want our Arkansas advocates and all of the different folks that are in this audience to go respectfully request favorable consideration from your legislators. Be professional. Be nice. And as Senator Dismang said, understand that they've still got questions that need to be answered. And we're trying to provide all the answers to them. So far, every question has been answered, and everyone that's been asked that's been answered has resulted in positive feedback. Not negative feedback, positive feedback. But you are their boss. You are my boss. We work for you. We work for the people of Arkansas, and that's who is in charge. And that's who we're trying to look out for. So before you leave, and they're busy, so if they can't spend but 10 seconds with you, don't begrudge them that. Don't hold them up. You got a lot of folks that want to see them. But please, before you leave, try to find your senator and your representative, shake their hand, tell them what you're here for, tell them what you believe in, and be respectful and ask for their support for what we're trying to do. It will help Arkansans, it will help Arkansas, it will make a difference today, and it'll make a difference tomorrow. God bless all of you for coming. I appreciate all your hard work. Thank you very much.